Hello, and welcome to the University of Calgary Veterinary Medicine One Health video series. My name is Dr. Lindsay Rodgers, and I am a veterinarian who worked in equine practice for a few years before transitioning back to school. I am now working on a master's degree, and if you're watching these videos, you must have some interest in One Health, which can be defined as a transdisciplinary approach to sustainable management of complex health problems arising from the interaction of animals, humans, and their environment. Antibiotic-resistant bacteria are one of these health problems, and that is what my project is about. So antibiotic-resistant bacteria are those that are no longer killed effectively by the antibiotics we have available. Some bacteria just naturally have genes that make them resistant, and other times they acquire these genes from exposure to the antibiotics. This exposure can come from treatment with antibiotics, whether in people or animals, and this includes the use of antibiotics in animals raised for food, like cattle or chickens. A concern is that using antibiotics in food animals will lead to antibiotic-resistant bacteria that could cause problems in humans from the food chain. This is one of the many questions we are looking into at the One Health program at the vet school in Calgary. So we have taken poop samples from cows and chickens, as well as meat samples from grocery stores. These would be the same that you would buy for your own food. From these samples, we isolated bacteria and looked at which antibiotics they were resistant to, or which antibiotics did not kill them that should have. But just knowing which antibiotics won't stop their growth isn't enough to know if the bacteria could move from animals into their meat products. We needed a more technical approach, so we then sequenced the genomes of the bacteria. This means that just like in humans or dogs, where we can send a DNA sample away to see what their heritage or breed is, we can look into the familial history of bacteria to see how they're related. The same species of bacteria can actually come from several different lines. If the bacteria from the poop samples and the meat samples contain bacteria from the same lines, then we need to investigate further how the bacteria could be moving from the animals to the meat. If they're from different backgrounds, well, then we think that any antibiotic-resistant bacteria in the meat isn't actually from the animal, but from a different source. So you can see how this is a One Health problem. It involves the veterinarians taking care of the animals, the farmers caring for the animals, the biologists running the samples, the computer geniuses that help analyze the data, doctors who take care of people, and the grocery stores and general public involved in retail. Antibiotic resistance is a very complex health problem involving the interaction between animals, humans, and their environments. By the way, the bacteria we find in meat products is normally there and killed when we properly prepare the meat. We're worried about it if it has extra genes to make it more antibiotic resistant. It's important to practice excellent hygiene when handling meat products and to cook your meat to the recommended temperature to kill these bacteria before eating. Following good food hygiene will help keep you and your family safe.